Is Dr. Isaac Bogoch, and he's an infectious diseases specialist and a member of Ontario's COVID-19 vaccine distribution task force. He's in Vancouver. Hello, Dr. Bogoch. Good to see you.
Hey, good morning.
So why don't we start right with the World Health Organization comments that we saw there in that clip. We know that it was creating some confusion and required some clarification. What do you make of the information that came out of the WHO and how it applies here at home?
Yeah, I like how you place this because context is extremely important. They were really referring to people who had already received, for example, a full course of a vaccine series, and then were, in all, for lack of a better word, choosing their own adventure, making this up as they go along and trying to get other vaccines and other additional doses of a vaccine. And as per the WHO, I completely agree. I think you've got to be very careful there. When they clarified their statements, the WHO basically mentioned that you can mix and match vaccines, and you should do so in a data-driven manner. You should not be making this up as you go along, and you should be following your public health leadership's advice, which is exactly what we're doing in Canada. We see terrific data from the UK, from Spain, from Germany, on the safety of mixing and matching vaccines, and also that this can provide a very robust immune response. So they were not referring to the type of mixing and matching that we're doing in Canada. Clearly, we've got it right, and we're doing it in a safe manner. It does produce a very robust immune response, and you're seeing lots of countries do this as well. For example, France and Germany have been doing it before even Canada even started considering it.
And, speaking of France, for example, France and Greece are just two of the countries, for example, that are suggesting that they should be mandating vaccines for healthcare workers. Wondering what you think of that approach and if it's something that perhaps Canada should adopt.
Oh, we have to very seriously consider this. If you're going to mandate vaccines in one place, it would certainly be in the healthcare setting. We deal with the most vulnerable of the vulnerable populations, people who are either frail, some people are on the older end of the spectrum, some people are immunocompromised in that they just don't have the same degree of an immune response to a vaccine and are very susceptible to infections, vaccinated or not. And you cannot have healthcare providers who, unfortunately are choosing not to get vaccinated, who get sick and who bring the infection into the workplace. And of course, whoops, got a little dog here, who get sick and bring the infection into the workplace. And who, it's like, you can't have that. It's just not acceptable. So I think that we should strongly consider that in healthcare settings in Canada.
And not only healthcare settings, I know there's some questions too now on whether or not the COVID vaccine should be mandatory as we look ahead to September for children aged 12 to 17, for example. We know that the Ontario government hasn't said whether or not they would be mandatory, but there are questions about that because there are other vaccines that are mandatory. So when it comes to reopening schools, teachers, students, what sort of mandate might be helpful in that respect?
Well, okay. I mean, if we just look at the science and the medicine of it, if you mandate vaccines in that 12-plus crowd, you will certainly create for a far safer school. You will. You just will. You just will have a lower probability of introducing COVID-19 into, for example, a school setting or an extracurricular setting. And you just have a lower probability of having that amplify in the school and affect other people either in the school or in the general communities. I think that's very obvious from a medical and scientific standpoint. Now enter the tug of war of individual rights and freedoms versus public health and public safety. I mean, obviously, this has been an issue long before COVID-19 was around, and this will continue to be an issue long after COVID-19. I really think it does warrant some consideration, though. It certainly does. And of course, we also have to acknowledge that these are vaccines that have not been around for decades. We just can't ignore that part of the conversation, that these vaccines have only been around for just over a year. We have to acknowledge that there are side effects with this vaccine. For example, in the 12-plus crowd, the rare, but of course not 0% risk of myocarditis. And I think that has to be entered into these conversations as well. Certainly, if we were going to pick a field to mandate it, I think the healthcare sector would be by far the #1 field. And you can do a lot of good and truly save a lot of lives because you're just going to have fewer outbreaks among vulnerable populations.
And I guess in line with that, of course, as we know, more research is coming out about the effectiveness of these vaccines too. And we saw that Pfizer is suggesting that you do need a third booster vaccine, and they were making that pitch to U.S. officials earlier this week. And so in terms of whether or not that is something Canada should consider, we know the World Health Organization is saying, really, can we focus on vaccinating the rest of the world before more strains become prevalent? So should we be even considering these booster shots for immunocompromised individuals, for example, as Israel is doing?
Yeah, I think there's a lot to unpack there. The first is that when we talk about boosters in general for the population of, let's just say, Canada or anywhere in the world, anyone who's had 2 doses of a vaccine, if we timestamp this and look at, where are we right now? The answer to that is no. It doesn't appear that we need booster shots for COVID-19. It looks like, as of now, the vaccines that we have that are currently available provide very robust protection, even against the Delta variant, for example, which is rapidly taking over. Now, there are smaller subsets of the population that may need a booster shot. And that, of course, includes people who are immunocompromised. These are people that just don't mount the same degree of an immune response to the vaccine. And I think we should be very open-minded into implementing this. And we know that some places are already doing this. There's excellent data actually pointing in the direction that it may provide a larger degree of safety for a small select cohort. And then, of course, the last point is that, even though we don't need booster shots now, we probably will at some point in the future. I don't know when that's going to be. Maybe it's 2022, maybe it's beyond. But I think we should be open-minded that we might need booster shots in the future. And of course, simultaneous with all this is, there's a lot of people on the planet that don't have access to these vaccines. Vaccine equity is a huge issue, and it's killing people right now, especially in low-income countries. And we really need to focus our attention on equitable distribution of COVID-19 vaccines. We have plenty of vaccines here in Canada. Canada made a large donation to the COVAX program the other day, and I hope Canada will continue to support that program in addition to other countries that have access to vaccines. I hope they continue to support the COVAX program as well. We really need to focus on vaccinating the world.
Yes, that donation, 17.7 million doses of AstraZeneca COVID-19 vaccine. That's what the donation Canada made. Thank you again so much for your time and for all of that information. That is Dr. Isaac Bogoch, and he joined us from Vancouver.